Lung cancer is a major cause of death worldwide, and its early diagnosis and staging are key to improving patient survival. Computed tomography, or CT-guided transthoracic biopsy, is currently considered the gold standard for lung nodule biopsy. However, it is associated with a high pneumothorax rate. Moreover, it does not allow staging, a crucial pre-treatment step required to assess the spread of lung cancer beyond the lungs to the center of the chest, called the mediastinum. At presentation, more than 70% of lung cancer patients show disease spread to the mediastinum. Hence, most patients who undergo CT-guided biopsy need to undergo a second procedure to detect mediastinal involvement. Cryoradial, a new procedure that combines cryobiopsy with radial endobronchial ultrasound, could help overcome these problems. Researchers from Australia and New Zealand conducted a randomized controlled study to compare the diagnostic yield and safety of CT-guided biopsy and cryoradial bronchoscopy across 3 tertiary teaching hospitals. Although the sample size was limited to 48 patients owing to enrollment challenges, the novel cryoradial method and the CT-guided method appear to provide comparable results. The cryoradial procedure diagnosed 85% of all patients who underwent the randomized procedure, whereas CT-guided biopsy achieved a diagnosis rate of 93.8%. However, while 44% of patients undergoing CT-guided biopsy developed pneumothorax and 2 required chest tube drainage, the rate of pneumothorax was 10-fold lower in the cryoradial group. These findings indicated that cryoradial is a similarly effective but safer biopsy tool in comparison to CT-guided biopsy, especially in people with pre-existing lung disease. Though the results obtained by these methods were comparable, due to the small sample size, there may have been a true difference between the diagnostic yields of the 2 methods that was not evident in this study. Nevertheless, using the cryoradial method could reduce complications, prevent hospitalization, and enable combined diagnosis and staging, decreasing the number of procedures and time to diagnosis and treatment. Hence, the adoption of cryoradial as a first-line biopsy method could help in decreasing the number of investigations and the time required for complete staging and treatment initiation in patients with lung cancer.